Welcome to the deep dive. Today we're tackling something maybe familiar, swollen glands. You might have felt it yourself or, seen it in a pet.
Right.
But we're going deeper than just swollen glands. We're really getting into lymphadenopathy, basically, what it means when lymph nodes get abnormally large.
Exactly. Think of lymph nodes as these tiny but really vital command centers all over your body.
Yep.
They're a huge part of your immune system, constantly on watch. So when they swell up, it's often their way of saying, hey, something's up.
Right, like an alarm bell.
Precisely. And this deep dive, well, we're going to explore the different reasons why these little sentinels of disease, as you might call them, get bigger.
And to help us unpack all this, we're drawing on insights from Veterinary Lymphadenopathy, Diagnosis, and Treatment. Now, I know the title mentions animals, but the core ideas, how lymph nodes work and why they enlarge, that's actually pretty similar across mammals, including us.
That's a great point. Yeah. Our goal today isn't just to stop at swollen glands. We really want to grasp the complexities behind why lymph nodes enlarge.
So you, the listener, can walk away with a clearer picture of how the body responds to all sorts of challenges.
From simple infections right up to more complex conditions. Yeah.
Okay, let's kick things off. Lymphadenopathy, bigger lymph nodes than usual. But it doesn't always look the same everywhere, does it? There are different patterns.
That's right. It can be generalized, meaning lots of nodes all over the body are enlarged, sort of like the whole defense network is on high alert.
Okay, system-wide.
Or it could be localized, just one node maybe, or a small group in one specific area. That usually points to a more regional issue.
So where it happens matters.
Definitely. It's a big clue.
And these nodes, they're not just bumps. They have a really important job, right? What's their main function?
Think of them like super sophisticated filters.
Filter.
Yeah. Lymph fluid, which is always moving around your body, picking up waste, cellular junk, that kind of thing. It all passes through these nodes.
Okay.
And inside, you've got specialized immune cells that trap and, neutralize any intruders, like bacteria or viruses. They're constantly cleaning house and defending.
So if they're working overtime fighting something off, it makes sense they'd get bigger,
Yeah.
like a muscle bulging after a workout.
Sort of, yeah. And our source material highlights 3 main biological ways this enlargement happens.
Right. What are those key processes?
Okay, so the first is called hyperplasia and reactivity of lymphoid elements.
Bit of a mouthful.
It is. But simply put, it means the immune cells inside the nodes, specifically lymphocytes and plasma cells, are increasing in number. They're reacting to something foreign, antigens that trigger the immune response.
So more soldiers being recruited.
Exactly. And hyperplasia itself, where just the lymphocytes multiply, that's often an early stage. The body's noticed something and is building up its defenses. So hyperplasia, that's the body calling in reinforcements.
Got it. Boosting the numbers. What's the second way they enlarge?
The second is through inflammatory infiltration. We also call this lymphadenitis.
Lymphadenitis. Okay.
This is different. Here, inflammatory cells like neutrophils, macrophages, sometimes eosinophils are actively moving into the lymph node.
So not just making more soldiers, but sending fighters directly into the node.
Precisely. This often happens if an infection has actually reached the node itself, or if there's an infection in the tissues that particular node drains. It's the body engaging the enemy right there.
So hyperplasia is like, alert, make more troops. And lymphadenitis is more like, troops, engage the enemy at this location.
That's a good way to put it, yeah.
And the third process?
The third one is neoplastic proliferation. This is about abnormal, uncontrolled cell growth.
Okay, that sounds more serious.
It often is. This can be primary, meaning the cancer starts in the lymph node itself. That's lymphoma, cancer of the lymphatic system.
Right.
Or it can be metastatic. That means cancer cells from a tumor somewhere else in the body have traveled and set up shop in the lymph nodes.
Wow. So like internal rogue cells multiplying or invaders from another part of the body.
Exactly. It involves the body's own cells going wrong or cells spreading from elsewhere.
And these processes, they clearly involve the blood, the lymphatic system, the immune system, basically the body's defense and transport networks.
Absolutely. It's all interconnected.
Our source also mentions, for dogs and cats anyway, there isn't like one specific breed or sex or age that just gets enlarged nodes more often.
Right. The enlargement itself is general. But the reasons for it, the underlying causes, those can definitely have specific risk factors tied to age, breed, and so on.
That's a key distinction. The swelling is a sign, but the trigger is specific.
And usually, unless the enlargement is really dramatic, the swelling itself doesn't cause obvious problems.
But if it is severe,
Yeah.
it can cause issues by just pressing on things.
Oh, definitely. Depends where the node is. If neck nodes are huge, it could make swallowing hard, maybe even cause regurgitation. Nodes
Okay.
in the chest could lead to breathing trouble, abdominal nodes, difficulty with, you know, bowel movements, and nodes in a limb could cause swelling in that limb.
And on top of that, the person or animal might just feel generally sick from whatever's causing the swelling in the first place.
Exactly. The systemic illness often comes from the root cause, not just the swollen node itself.
Okay, basics covered. Now let's dig into the why, the specific causes. We mentioned lymphoid hyperplasia or reactivity first, that immune system ramp up. What typically triggers that?
Well, infection is a really big one.
Makes sense.
Could be localized just in one spot or systemic, affecting the whole body.
Yeah.
And the culprits: bacteria, viruses, fungi, protozoa, even algae sometimes.
Wow, quite a list.
And interestingly, the node swells up even if the infection isn't in the node itself. It's reacting to pathogens nearby or circulating in the body.
Like the neighborhood watch spotting trouble down the street and calling for backup.
That's it. And our source notes something interesting too. Sometimes the same bug might cause active inflammation, lymphadenitis, in one node, but just hyperplasia, that cell increase, in another.
Huh. So the response can vary node by node.
It really shows how nuanced the immune response can be. It might launch a direct attack here while just boosting defenses over there.
Are there specific infections known just for causing hyperplasia without major inflammation?
Yeah, some specific agents often do that. Things like Rickettsia, Bartonella, which you might know from cat scratch disease, and Brutella canis.
Okay. And what about viruses like FIV and FELLV in cats? Those are common.
Ah, yes. They're interesting. Early on with FIV or FELV, you often see generalized hyperplasia. The immune system is trying hard to fight the virus off.
Right.
But later, those viruses can actually damage the immune system, leading to lymphoid depletion, fewer immune cells.
Oh, so it flips later on.
It can. And importantly, because they weaken the immune system, cats with FIV or FELV are more prone to getting secondary infections. And those infections can then cause lymphadenitis.
Wow, so it's a whole cascade of effects. Complicated.
Very.
Okay, besides infections, what else gets the immune system ramping up like that, causing hyperplasia?
Well, non-infectious things can trigger it too. Allergens are a good example.
Like hay fever season, making your glands feel a bit puffy.
Exactly that kind of thing. Also, immune-mediated diseases, conditions where the body's immune system mistakenly attacks itself, like lupus, SLE, or rheumatoid arthritis, can also lead to reactive lymph node enlargement.
Okay, that covers the reactivity side. Now, lymphadenitis, active inflammation in the node, what are the usual suspects there?
Bacteria are very common. They often cause what's called purulent lymphadenitis, basically, pus formation. It can even lead to abscesses inside the node.
Yeah.
Examples include things like Mycobacterium species, Bartonella, again, which can cause a specific type called granulomatous inflammation, and then a whole range of other bacteria, both aerobic and anaerobic, like Pastorella, Bacteroids.
Lots of different bacteria.
Yes, and even some quite serious ones like Yersinia pestis, the plague bacterium, and Francisella tularensis, which causes tularemia. So it spans common skin bacteria to major pathogens.
Definitely sounds serious. How about fungi causing lymphadenitis?
Systemic fungal infections are definitely on the list. Things like histo, blasto, crypto, sporohistoplasmosis, blastomycosis, cryptococcosis, sporotrichosis.
Okay.
And the source stresses that if you see multiple lymph nodes involved, especially internal ones, it's a strong sign the fungal infection has spread systemically.
That's a really important diagnostic clue. Widespread involvement often means a body-wide problem.
Exactly.
Our source also mentioned some less common causes for lymphadenitis.
Yeah, sometimes protozoa, algae, or even certain parasites can cause inflammation in the nodes. But the key thing to remember usually is that lymphadenitis happens because of an infection in the tissues drained by that node.
So the node is reacting to a fire in its district, so to speak.
Precisely. Though direct infection of the node can happen too, it's less common.
And there's also eosinophilic lymphadenitis. What's going on there?
Right. Eosinophils are those white blood cells often involved in allergies and fighting parasites.
Okay.
So eosinophilic lymphadenitis can pop up with allergic inflammation nearby. Think severe flea allergy dermatitis, causing nodes in that area to react. It can also be part of more complex systemic diseases involving eosinophils, or even happen when a node is draining a mast cell tumor.
So again, the type of inflammation gives clues too. Fascinating.
Yeah.
And as you said, lymphadenitis and hypoplasia can happen together.
Absolutely. The body can throw multiple responses at a problem simultaneously.
Okay, finally, let's revisit neoplasia, abnormal cell growth. We mentioned lymphoma starting in the node. What about cancer spreading to the nodes?
Well, in cats, ALV, that feline leukemia virus, is a big risk factor for lymphoma. It can actually cause lymphocytes to become cancerous.
Right.
In dogs, the cause of lymphoma is often, well, unknown. Just happens.
Mhm.
As for metastatic tumors, cancer spreading from somewhere else, the original tumor could be almost anywhere. Sometimes it's not immediately obvious where it started.
So enlarged nodes could be the first clue that there's a hidden cancer elsewhere that is spread. That really underlines why investigating them is so crucial.
Definitely.
Okay, we've touched on risk factors along the way, but let's pull them together. What makes someone, or an animal, more susceptible to lymphadenopathy?
Well, anything that impairs immune function is a big one. A weakened immune system just makes infections more likely, and those infections can lead to lymphadenitis.
Makes sense.
Also, individuals with ongoing allergic diseases are more likely to have reactive hyperplasia or that eosinophilic lymphadenitis because their immune system is constantly being stimulated.
And we mentioned the cat viruses.
Yes, FeLV and FIV are major risk factors for lymphoma in cats. Absolutely key.
And the risk of nodes enlarging due to spreading cancer.
That really just depends on the type of primary cancer. Some cancers are just much more prone to metastasizing to lymph nodes than others.
This paints a picture of, well, a really complex situation, lots of potential triggers.
Yeah.
So if you or a vet finds enlarged lymph nodes, what's the plan? How do you figure out what's actually causing it?
Right, the diagnosis. Usually it starts with finding a lump in a spot where you'd expect a lymph node.
Okay.
But you can't just assume it's a lymph node.
Huh.
So often the first step, as our source points out, is getting a sample of cells, usually with a fine needle aspirate, or FNA.
Taking a little poke.
Exactly. To look under the microscope, confirm it is lymph node tissue, and get that first crucial look at what kind of cells are in there.
And where are these typical locations? Where can you normally feel lymph nodes?
In dogs, the ones you can usually feel if they're normal size are under the jaw, mandibular, in front of the shoulder, prescapular, in the armpit, axillary, the groin area, superficial inguinal, and behind the knee, popliteal.
Okay.
Others, like facial nodes, ones behind the throat, retropharyngeal, or in the pelvis, iliac, you usually only feel them if they get enlarged. And remember, the exact palpable nodes might vary a bit between species, humans included.
Does the actual size of the enlarged node give any clues?
It can, yeah. Really big nodes, say more than 5 times normal size.
Mhm.
That often makes you think more strongly about either an abscess, severe lymphadenitis, or potentially lymphoma.
And smaller enlargements.
Smaller increases could still be reactive hyperplasia, maybe milder lymphadenitis, or even early neoplasia, including metastasis. Metastatic nodes can really vary in size.
What about how many nodes are affected? One versus many.
That's really important too. Multiple enlarged nodes all over. That screams systemic issue, something affecting the whole body, like lymphoma or a widespread infection causing either inflammation or hyperplasia.
And just one enlarged node.
A single enlarged node is more typical for something localized, like an abscess from a nearby infection, or maybe a single spot where cancer has spread.
So a good physical exam is step one, but that's often just the start, isn't it? What about lab tests? Blood work.
Oh yeah, blood tests and sometimes urine tests are standard early steps. A CBC, complete blood count, can show things like low cell count cytopenias, which you might see with lymphoma, chronic disease, stress, even some infections.
What about high counts?
An increase in lymphocytes, lymphocytosis, could point to certain infections like rickettsial disease in dogs or lymphoid cancer in dogs or cats. Seeing weird-looking, atypical lymphocytes, that really bumps up suspicion for cancer.
And we talked about eosinophils seeing more of those points towards allergies or parasites, right?
Exactly. And high neutrophils, another white blood cell type, especially with immature forms present, that suggests inflammation, reactive hyperplasia, or maybe neoplasia too.
Any other blood clues?
High calcium hypercalcemia, that's pretty common in dogs with lymphoma, less so in cats. And high globulins, certain blood proteins, can indicate chronic inflammation or lymphoid cancer.
So blood work gives a good systemic overview. Any more specific lab tests?
Definitely. In cats with big nodes, testing for FLEV and FIV is crucial given their links to lymphoma and immunosuppression causing other issues.
Right.
And depending on the signs and where the animal lives, you might do specific blood tests, serology for systemic fungi like blasto or crypto, or bacteria like Bartonella.
Imaging must be important too.
Yeah.
X-rays, ultrasound.
absolutely critical. Radiology and ultrasound let us see those internal lymph nodes we can't feel.
The ones inside the chest or abdomen.
Exactly. And imaging can also help find related problems elsewhere, like spotting pneumonia if you suspect blastomycosis, or finding a primary tumor if you suspect metastasis to the nodes.
Okay, physical exam, blood work, imaging. But often, you need to look right inside the node at the cells themselves. That's where procedures like that fine needle aspirate come in.
Yes, FNA cytology is a cornerstone. You take that small cell sample with a needle, put it on a slide, stain it, and look under the microscope.
What can you tell from that?
A lot, usually. It helps categorize the enlargement. Is it mainly hyperplasia, inflammation, or neoplasia? Sometimes you can even diagnose specific infections right there, see the actual fungi or bacteria, or identify specific tumor types.
Right.
Usually a standard stain, like a diff-quick, is enough. But if you suspect bacteria, maybe a gram stain to help identify them.
What do the different conditions look like under the scope?
Well, reactive or hyperplastic nodes. You see a mix of cells, mostly small lymphocytes, but also some larger ones, plasma cells, maybe a few neutrophils or eosinophils, a mixed bag of normal immune cells, basically.
Okay. And lymphadenitis.
With lymphadenitis, you'll see loads of inflammatory cells, neutrophils, if it's bacterial, maybe macrophages, maybe eosinophils, depending on the cause. And like I said, sometimes you see the actual bugs. It can be really diagnostic for systemic fungal infections.
And cancer. Lymphoma or metastasis.
Lymphoma typically shows a huge proportion, like over 50% of large, immature-looking lymphocytes. We call them blasts. They often have characteristic features in their nucleus.
Right.
Metastatic cancer. You see cells that just don't belong in a lymph node at all. Their appearance depends entirely on what type of cancer spread there.
Cytology sounds incredibly powerful, but the source mentions it's not always definitive, especially in cats.
That's true, particularly in cats. Sometimes severe hyperplasia, just a massive increase in normal lymphocytes, can look very similar to lymphoma on cytology alone. It can be tricky.
So what do you do then?
In those ambiguous cases, or if cytology isn't clear, a biopsy is often needed, taking a larger piece of tissue or even the whole node.
A surgical sample.
Yes. An excisional biopsy, removing the whole node, is usually preferred because it gives the pathologist the best view of the node's overall structure, the architecture.
And even if cytology does suggest lymphoma, you still might do a biopsy.
Ideally, yes. Histopathology, examining the structure of the excised node, confirms the lymphoma diagnosis. But importantly, it also allows for grading the lymphoma, understanding how aggressive it is. That's crucial for planning treatment and predicting the outcome, the prognosis.
So diagnosis is this multi-step process: exam, labs, imaging, cytology, maybe biopsy. Once you have a diagnosis, what about treatment?
Well, the treatment completely hinges on the underlying cause, because lymphadenopathy itself is just a sign.
Right, not the disease itself.
Exactly. So, since there are so many different possible causes, infections, inflammation, cancer, there's no single treatment for lymphadenopathy. You treat the root cause.
And there was a specific warning in our source about using corticosteroids if you suspect lymphoma.
Yes, that's important. Steroids can actually kill some lymphoma cells.
Which sounds good, but
But it can make it harder to get an accurate diagnosis and, crucially, to properly stage the cancer, figure out how far it's spread, which you need to do before starting chemotherapy if that's the plan. So the general advice is to hold off on steroids if lymphoma's on the table until all the diagnostic workup is done.
okay, good tip. So the actual medications will vary wildly. Antibiotics for bacteria, antifungals for fungi, maybe anti-inflammatories for allergies, chemo for cancer.
Exactly. It's totally dependent on the diagnosis.
And monitoring how things are going. You just keep checking the nodes.
That's a big part of it, yes. Follow-up usually involves regular physical exams, feeling those nodes to see if they're shrinking in response to whatever treatment is being given.
This has been, wow, a really deep dive, actually, into something that seems simple, swollen glands. But, as we've seen, lymphadenopathy is this signpost pointing to a huge range of underlying issues.
It really is. It highlights just how interconnected everything is in the body. The immune system, infections, inflammation, even abnormal cell growth. These little nodes truly are sentinels, aren't they? Constantly monitoring, alerting us to problems.
Yeah, vital sentinels. It really drives that home. And thinking about that, here's a final thought for you, our listener. If lymph nodes are such key sentinels, what other, maybe seemingly minor physical signs could also be early warnings? Subtle clues about bigger things happening inside.
That's a great question.
Something to think about the body's subtle ways of communicating. Thanks for joining us for this deep dive.